acute heart failure and hypertension and atrial fibrillation and that's about it. But the meds that we gave to our patients, well, one of them is amlodipine, and when you're giving this, the nurse may or may not give it with food in case GI upsets occur. Then that's when you can give it. Let's see. For other, it's a calcium channel blocker, and with those, if you're giving it in a suspended release capsule, the capsule should not be open or chewed. But if you are given a sustained release, it may be open, content sprinkled in liquid or meal. And for one that is another calcium channel blocker is diltiazem, can't really say it, may be crushed or mixed with food or fluids for patients with difficulty swallowing. And when you do give these meds to turn your patient slow and getting up slow, like whenever you're administering in the orthostatic hypotension.
So even though they're not getting up, even just turning them in the bed, a sudden turn or shift in the bed could cause them to have an orthostatic hypotension. So that's why it says turn slowly and then rise slowly.
Yes,
so amlodipine is a calcium channel blocker, which is to treat hypertension. It relaxes blood vessels, increase supply of oxygen to the heart, and reduces the heart's workload. So our patient has heart failure and hypertension, and so we're trying to help the heart not work so much. For patient teaching, you want to advise patient to have blood pressure checked routinely for possible hypertension, and suggest to take amlodipine with food to reduce GI upset. Tell patient to immediately notify primary care physician of dizziness, arm or leg swelling, difficulty breathing, hives or rash. Nursing consideration is use cautiously in patients with heart block, heart failure, or impaired renal function, hepatic disorder, or severe aortic stenosis. Monitor blood pressure while adjusting dosage, especially in patients with heart failure or severe aortic stenosis, because symptomatic hypotension may occur.
He's also getting a thrombolytic because she had a blood clot. The medication that we gave was antiplase, and it's by IV only. It dissolves clots that are already formed. It's not to prevent blood clots. The most adverse reactions are all bleeding related. They are very prone to bleeding. When you take their IVs out, you have to apply pressure for 30 minutes because they can bleed a lot that way. You cannot take any other type of medications that are going to thin the blood. You need to get baseline vitals and blood test. Also, it can cause ulcers, so you can give them H2 antagonists to prevent them from getting ulcers and bleeding. And then after they're off of it, most of the time they'll take an aspirin to keep the blood thinned. And you need to teach them signs of thrombosis, which is most of the time it's in the lower extremities, and it's going to be redness, warmth, tenderness, swelling, and sometimes your veins will become visible. Report bleeding immediately and apply pressure and limit your physical activity because it makes you at risk for an injury which can cause bleeding, and not to take NSAIDs or any blood thinning medications.
We're also going to give digoxin, a cardiotomic, to treat the heart failure and atrial fibrillation. We're going to monitor the potassium serum levels, assess the applicable pulse rate for 30 seconds, take at the same time each day. And then also you would want to teach them to check their pulse so they can know it, their blood pressure before, so they can know it before each dose is taken. If it is taken with food, your absorption is slowed, but the amount is the same. So just, you can take it with food if you want. If it's taken with high fiber meals, absorption may be decreased. You also want to do a blood sample to look for digitalis toxicity, and the symptoms for that is loss of appetite, nausea, vomiting, and diarrhea, beat faster or slower, or your heartbeat is faster, slower, or irregular, confusion, bright spots, blind spots, blurry vision. Your urination is abnormal, and you can also become swollen.
A 48-year-old man who does shift work, so he's super stressed out. He is in a hypertensive crisis. He has a new diagnosis of hypertension. We're worried for a stroke, and he is tachycardic. He also, the signs of him being in a hypertensive crisis is severe chest pain, headache, blurred vision, anxiety, shortness of breath. It could be nausea or vomiting, but we chose he is not. And you can be unresponsive, but he is responsive. So.
Okay, so, well, you want to do yours first.
We're going to give him hydralazine because it's going to dilate the blood vessels because he is at risk for a stroke. Correct.
Heart attack, because he's hypertensive crisis.
And that's used to treat the hypertension, which is high blood pressure. The adverse reactions to the drug are headache, anorexia, nausea, vomiting, diarrhea, fast heart rate, chest pain, hypotension, dizziness, swelling in arms and legs. We are going to monitor his heart rate because the drug induces it. Heart rate, 20 beats per minute or more than normal. Rapid weight gain, 5 pounds or more. Unusual swelling, dyspnea, angina, indigestion, and fainting. And we're going to continue to monitor the blood pressure. Weight check daily during therapy. Check blood pressure standing, sitting, lying positions. Check on both arms. And when moving or standing up, change positions slowly, especially in the morning. Get blood pressure checked regularly. Report swelling, monitor heart rate, monitor weight, take with food. Hot showers may increase hypotension.
Did you say what class?
Vasodilating drugs.
And that one is used like in an urgent case to get it down in an emergency case, not really to maintain it for everyday taking. Which one did you have?
Centerville.
Okay, so I'll just do mine. So also, since he's at risk for stroke, and we had mentioned that our patient is not just morbidly obese, but he's overweight. He works shift work, so he eats a lot of fast food. So we drew a lipid panel on him. His LDL was high, so we are starting him on a statin. What was the one we ended up? Rosuvastatin was the one we ended up actually choosing. That inhibits the manufacturing of cholesterol or promotes the breakdown of cholesterol. It lowers the LDL and increases the HDL. It treats hyperlipidemia, and it's primary prevention for coronary events, so stroke, things like that. Its adverse reactions could be headache, blurred vision, insomnia, dizziness, flatulence, cramping, abdominal pain, nausea. The statins in particular are pretty hard on the liver. So you can also, it can cause a elevated CPK level or the rhabdomyolysis. Yes, that one again, which is rapid muscle breakdown. So you don't want to give it to anyone who already has muscle diseases. You don't want to give it to people who have endocrine disorders or history of alcoholism, because it is already super hard on the liver. So if they're alcoholics, that's just a good combination for liver failure. And that's it on that one.
And then we're also gonna give him lisinopril. It's an ACE inhibitor antihypertensive drug to manage his hypertension for in the future. And then his adverse reactions are orthostatic hypotension. So you need to teach the change position slowly and all that stuff. And then it can cause gastric irritation. So you can take the med 1 hour before or 2 hours after meals so you don't have any of that, and it enhances absorption, and then it can cause a cough, so they have to be able to tolerate that. And then you just have to monitor their blood pressure every 15 to 30 minutes after administering the drug, and take it before. For your interventions, you need to monitor their blood pressure, take their weight, examine for edema, and you need to record their blood pressure and their pulse in both arms, sitting, standing, and lying down, and then just continue to monitor and record their blood pressure.
Also, I didn't mention the statin, the class it is the HMG CoA reductase inhibitors. That's the class of that one.
So we have an 80-year-old male that came in that had a thrombolytic stroke, and also have history of DVT, cardiomyopathy, and AFib flutters. The cause from the stroke was when the blood clot formed in the patient's leg, traveled up to the heart and into the brain. Blood clots are formed from plaque buildup in your arteries called arteriosclerosis. So we started him on a statin drug. The statin drug that we chose was Lipitor. The adverse reactions for that drugs make us feel bad. It's constipation, blurred vision, headache, dizzy, abdominal pain. But first we want to tell the patient to modify his diet and exercise, of course. Another important thing to watch while taking this med, it can increase your blood glucose levels, so we want to just check his sugar. We want to access the bowel function because it can cause constipation, and stay away from grapefruit juice. We also put the patient on metoprolol, digoxin, and heparin.
He's also on metoprolol. It is a beta blocker. Beta blockers are commonly used for rate control and are effective in reducing resting and exercise ventricular rates. Beta blockers are also used for hypertension, which works by vasodilation. The adverse reactions of metoprolol are dizziness, tiredness, depression, shortness of breath, bronchospasms, swelling of the hands, feet, ankles, or legs, weight gain, leukopenia, and thrombocytopenia. An important thing to know about metoprolol is do not stop taking this medication without talking to your doctor. Suddenly stopping may cause chest pain or heart attack. It's contraindicated in people with heart blocks, sick sinus syndrome, slow heart rate, severe circulation problems, or severe heart failure. Patients should start this medication at a low dose and then increase. You should instruct the patient to take metoprolol with food at the same time each day. They may have tablets but do not chew or crush them. Advise patients to notify prescriber if pulse rate falls below 60 beats per minute. And their pulse rate and blood pressure should be monitored frequently.
We have him on heparin, which is a blood thinner. The uses are prevents and treats DVT, AFib, pulmonary embolism. It's an adjuvant treatment of MI, prevention of thrombus formation after valve replacement surgery. The adverse reactions are bleeding, alopecia, rash, hepatitis, jaundice, thrombocytopenia, and blood dyscrasias. The contraindications are active bleeding, hemorrhagic disease, tuberculosis, leukemia, uncontrolled hypertension, GI ulcers, recent eye and CNS surgery. Use during pregnancy can cause fetal death. Precautions are patients with fever, heart failure, diarrhea, diabetes, malignancy, hypertension, and psychosis. And patients with potential site for bleeding or hemorrhage. Assess skin for bruising.
And we're also going to put, is it a him? Mr. Smith, I can't remember. On digoxin, he has cardiomyopathy. It's a disease that affects the heart muscles.
The symptoms are shortness of breath, feeling tired, swelling of the legs. It's a cardiotonic. It increases the force of the heartbeat, so the digoxin causes positive inotropic effects. You want to stay away from high fiber foods because it inhibits the absorption and also causes electrolyte imbalance. Take his apical pulse before each dose, notify prescriber if it's below 60 beats a minute, and monitor closely for toxicity.
And the patient teaching, important, take as prescribed, warn about toxicity if taken too much or too little. Take it same time each day. Take your pulse and instruct the patient to do so before each dose, and urge patient to contact PCP if pulse falls below 60 beats per minute or suddenly increases. Instruct patient to carry med ID that indicates need for digoxin. Advise patient to consult prescriber before using other drugs, including over-the-counter drugs. Stay hydrated, can cause electrolyte imbalance. Stay away from high fiber foods, inhibits absorption, and monitor swelling. If needed, contact doctor.
Mrs. Peabody, she's 84 years old. She's a Caucasian female, sorry. Her vitals is 146/97, her pulse is 96, her respirations is 10, her oxygen is 81%, and her pain is 9. So Mrs. Peabody is really sick. She has a diagnosis. She has end-stage COPD, right-sided heart failure, and a history of hyperlipidemia and hypertension. So we did a lipid panel on Mrs. Peabody, and her LDL is increased. So we started her on anti-hyperlipidemic medication, which is the HMG-CoA reductase. Lovastatin is what we started her on. And lovastatin has many adverse reactions: headache, blurred vision, dizziness, insomnia, gas, cramping, constipation, nausea. Also the rhabdomyolysis, which is muscle breakdown. So since she's in the bed, we also gave her a catheter. She's not moving very much, so she has constipation. So we're gonna add Colace, which Colace is gonna help her to move her bowels, because she has a low appetite because she's on the 2 liters of oxygen. She has the end stage, so really 2 liters will help her, but you really won't give medication with the end stage COPD, because if we, because she's at the end stage. And then also too, we don't want to give her more than 2 liters of oxygen, because it's going to put her, it's going to knock out her respiratory drive, which what that does is increases her CO2, and it's going to lower her. So really she's going to be working really hard. We giving her, just say we gave her 4 liters. It's making her work really hard. So in other words, she's going to tire out. So we're going to keep her on 2 liters, keep her comfortable. Also, Mrs. Peabody is, we're going to add nitroglycerin, because when we move her to change her, she has a catheter, so just in case she has a bowel movement, when we move her, she gets exertional pain. So we're giving her the nitrostat, or she gets exertional chest pain, so we're giving her the nitrostat for that. Also, we're going to give her furosemide, which is Lasix. We're not going to do an IV, we're just going to do, a pump, I'm sorry. We're just going to do an IV push, because she has distended jugular vein, she has edema in her legs, and of course she's not moving. So we also going to give her Lovenox, and that's where Lovenox was not.
Okay. So we're going to give her Lovenox. It's a blood thinner to prevent blood clots while the patient is immobile, and you give the Lovenox sub-Q.
Yes.
And
Intro.
from the belly button.
Oh, an inch from the belly button.
No more than 8 days, because after the 8
8
days,
days
she'll
she'll
get
go
an
on
It's
aspirin.
usually short term.
Yeah.
Okay.
It only goes for 8 days. After the 8 days, she'll probably take an aspirin, 81 milligrams.
Yeah.
Okay.
Because they're giving it the Lovenox for immobility.
Okay, Mrs. Peabody is, like she said, she's taking a HMG-CoA inhibitor. So, and she said we did the lab test, and they said that her LDL was elevated. So we also did a blood glucose test, the HbA1c labs, as a baseline because you have to check it as long as they're taking it. We expected her skin and eyelids for xanthomas, which is the yellow deposits. We monitored her liver function, checking her AST levels, which all has to do with her liver. Because if her AST levels is rise times 3, you have to discontinue the medication and find, I guess, something else that'll work. She said we're doing a cold lace because of the constipation. Also, it may make her dizzy. So one of the nursing diagnoses was risk for injury. Y'all remember that? Y'all know how much cold is. I think that's about it. What?
I said that's it for you?
Yeah, go ahead.
Okay, so for the hypertension, we are gonna give her, doxazocin to manage the hypertension. And we wouldn't give it to her if she had a allergy to it. We would check before we administer it that she can swallow good. And as I said, move slowly when we turn her because it can cause dizziness, headaches, orthostatic hypertension, and as well if she was to have cataract surgery in the future, she would have to let her surgeon know and warn him that she was on that medication because it can cause floppy iris syndrome. And then it causes diarrhea, but it can also cause constipation, so that's why we're giving her that constipation medicine, Tolase. We would monitor her BP every 2 to 6 hours or as needed. We would do tests for renal and hepatic function. And we would give cautiously if she had like her hepatic disease. We would monitor her urination because it can be used for urinary retention, and since she won't be moving a lot and she have a catheter, just monitor that. And it's best taken morning or evening with food if desired to prevent GI upset. And as well, it can cause swelling in the limbs.
I forgot to add that with the statin that she's on, that no grapefruits, no grapefruit juice, nothing grapefruit. And you'll give it at night due to it lessens the effects of the adverse reactions for that statin. And that's it.